Okay, good afternoon. We will start now. So I'll introduce to the students our guest speakers. Uh, Dr. Shan, who's a GMC registered doctor who has completed his PLAB 1 and PLAB 2 and now planning to go to the UK to work as a doctor. And we have Dr. R.U.Waidyaratne, a general practitioner who's practicing in the UK. And I will give Dr. Shan to start with the introduction.
Yeah. Okay. Hello. Thank you, Dr. Harindu. Can you see me and hear me clearly?
Yes.
Okay, good. Great. So, good evening to all the students and participants. I'm Dr. Shan Perera, and I completed my PLAB 2 in 2022 July, and I got my GMC registration in December 2022, just a couple of months back. And currently, I'm awaiting employment in the UK. So before moving on and before I move on to the UK, we are trying to establish a pathway to all our candidates, to all our junior doctors, and to our fellow colleagues who are interested in doing the same pathway as myself and finally achieving their goals and dreams in practicing, in the NHS someday. So you have me and Dr. R.U.Waidyaratne, who is a GP in the UK currently, and we'll be here to answer all your questions and queries regarding any doubts you might have. It could be regarding the program or any questions about the UK MLA or anything beyond that, especially obtaining a job in the UK, which is one of the hardest part to the questions that we receive from most of our candidates is there enough jobs in the UK? Do we have a chance of applying to the UK and practicing there? So all your queries will be answered in this program. So we'll start with the PLAB Masterclass orientation. So if I give you a general overview, okay, before moving on, just one last time, Dr. Hindu, am I clear and is my screen visible to all?
Yes, you're clear and everything's good.
Okay, good. All right. So today we're gonna talk about the basic structure of the PLAB exam. Along with that, what our institute at Amrak, what we offer to all our candidates. All right. So when we talk about the PLAB pathway, we know it's not only doing the PLAB 1 or doing the PLAB 2. There are certain steps that we need to take before we could move on to sitting for a PLAB exam. So if I give a basic overview, number one, we're going to talk about the PLAB 1 or the UK MLA. So what is PLAB 1? Basically, PLAB 1 is a written exam which is made up of 180 MCQs. To most of our candidates who are in doubt, it's a single best question type of scenario where you have to choose the right answer out of five answers, a single best. Some candidates were asking me, is there minus marks? Do we have true and false? So, well, there are no true and false and there are no minus marks. The idea behind this is that you have to answer 180 questions in 3 hours. If you look into it, it's 180 questions in 180 minutes. That means you have only 1 minute per question. And therefore, your ability to answer questions, your ability to read through, obtain clinchers, get hints, thorough reading, right? You have to be a bit more fast. You cannot take your time and move on from one question to the other because that will consume a lot of time and in the end you won't be able to complete your exam, right? So this is the PLAB 1 and normally what they say is you have to get at least 60% mark in order to pass. That means roughly speaking 115 to 125 questions should be answered correctly. However, it depends on certain exams. For example, during my time, my average score was 118. Right? One of my friends who did the exam, it was 128, I suppose. Yeah. So that means it depends on the toughness of the exam as well. Okay. So we have this question to us, what is UKMLA and PLAB changing on to UKMLA. So just giving an overview, you don't have to worry so much about it because it's just the same structure with a bit, more fancier name, I suppose. So basically UKMLA is the UK Medical Licensing Assessment Exam. Yeah, it requires both the international medical graduates and even the local UK graduates to sit for the exam. Now, unlike the PLAB exam, where only the IMGs, only the international medical graduates sit for it, um, this UKMLA is for all the candidates. Doesn't matter if you're an IMG, doesn't matter if you're in the UK in the system, you have to do the UKMLA part. Now it's going to divide into two more structures. Number one, PLAB 1 is going to change to something called the AKT, as you can see here, the Applied Knowledge Test. There was one candidate who asked me, is there going to be, is it going to be the similar structure? Is there going to be something else in, the AKT program? Well, for now, the information that we have, what the GMC refers is that it's going to be a bit more, uplifted. Yeah, it's going to be a bit more tough. But however, the standards and the question structure is going to be the same. And no matter what, I mean, what we do or how we study, the medicine, the guidelines, the NICE guidelines, CK's guidelines, it's not going to change, right? It's going to be updated, but I don't think the medicine or the structure of the questioning or the content is going to change. There might be a bit of, questions which could be from different sections, but however, we are planning to have a proper guidance so all our candidates do not have to worry about, no matter it changes to AKT or it changes to PLAB, right? It's a computer-based exam, by the way, and also it's held 4 times a year. Now, moving on to part 2, which is a PLAB 2, they're going to change it to something called the CPSA. As you can see here, it is a clinical and professional skills assessment. It's just like how we do it in PLAB 2, and we have to go to the UK and do the exam. Whereas PLAB 1 could be done in Sri Lanka, Bangladesh, India, various sort of countries or various countries. But in case of PLAB 2 or CPSA, you have to do it in the UK in their clinical assessment center in Manchester, right? Am I clear so far, Dr. Harindu? Is it? Am I going fast or?
You're clear.
Yeah.
I think so.
All right.
Let's ask the participants whether they understood everything or
do they
have any questions
so far? Yeah.
till now.
Don't be shy. You can ask questions. It's all right. And if you feel like it's hard, you can just type in the chat box, and Dr. Harindu or myself or Dr. Win would be more than happy to answer. Shall we move on with the session, Dr. Harindu? Or?
Yes, we'll move on and we'll give time at the end.
All right. Okay. Dr. Uveen, I mean, if there is anything you want to interrupt and add in, please let me know, and I'll hand it over to you as well.
Sure, thank you. No, you're doing well, Shan. Yeah, we'll proceed. Yes.
Thank you, Dr. Uveen. Okay, so moving on to our program. So this is what we at Amrak is going to provide to all our candidates. So the course for PLAB 1 is going to be of 96 hours, okay, which is going to be 3 months duration. But right now we are planning to, do it a bit longer. It could be 3.5 months, but the current idea is to stick with 3 to 3.5 months, which is roughly 12 to 15 weeks time. Okay, and we are going to have consultants for each subject. For example, for medicine, surgery, GynOps, pediatric, and psych. Psychiatry also comes with something called ethical scenarios. So for these 5 major subtopics, we're going to have 5 consultants and professors guiding and teaching to all our candidates throughout the path and the program. And another very important thing is the access to the Plabbable app. Now, what is this Plabbable app? Well, It is an online question bank which has all the latest updated guidelines, all the nice guidelines, the CK's guidelines. I mean, the latest updated version is going to be provided to all our candidates free of charge for 6 months duration. All right, and it's one of the best question banks that are available, and most of our consultants and our professors are going to refer to that question banks as well. And it has more than 3,000 plus questions, and it has subcategories. For example, in medicine you have cardiology, nephrology, neurology, rheumatology, gastroenterology, you name it, everything is divided into subtopics. And if you feel like you have certain doubts, you could maybe mark it out, talk to our consultants, discuss questions online, and go ahead with the program. um, our program is going to be online only. There is not going to be any physical classes because now it's very convenient since we have online structure built up really well, and all the lectures are going to be restreamed through our LMS system, where you can go in and have a look. We'll be having limited hours for that because to prevent candidates from not coming to lectures, because we need the attendance of students so that the consultants are engaged, and we can have a better interactive session. All right, so moving on, this is just our structure, that what we are going to provide to you guys. Now let's move on to PLAB 2. Now PLAB 1 is kept aside for now. For PLAB 2, it's basically a clinical exam, a structured clinical exam, which is made out of 16 scenarios. Back then, before 2020, during the COVID time, before that, they used to have 18 scenarios, and you have to pass around 10 to 11 stations. Okay, but right now they have reduced it to 16 scenarios, and you have to pass a minimum of 9 to 10 sessions. That too depend on that particular exam date, how the number of candidates performed, the average marks, the number of scenarios or stations that have been passed, and they give an average, and on that particular day it depends. For example, if I take my exam, which was held in July, I had 16 scenarios or 16 stations, but they had removed one station. So one station was completely off. So we had only 15 stations, although I appeared for 16, and we had to pass 9 out of 15. For my previous batch, it was 16 and they had to pass 10. Furthermore, it's not only the number of stations that you need to pass. There is something called, you get a mark sheet, and you have to get an average score, and you have to go beyond the average score. So what we recommend to our students is that even if you fail a scenario, it's all right, but fail with dignity, fail with at least trying to get the minimum marks, right? So we are going to provide a very structured program for PLAB 2, so that our students can pass the exam in one go and achieve the maximum marks possible. Moving on to the next slide. As you can see, PLAB 2, basically everything is available on the GMC website, and also we are going to provide all the details to you guys as well. But just to give an idea, PLAB 2 is basically divided into 3 main domains, which is 1, data gathering, technical and assessment skills. That means, how well do you take history, a relevant physical examination, how much of a focused history do you take. On certain scenarios, you might understand that it is a counseling session, so you have to be very wise in dividing your 3 domains into history taking, a short focus history taking, focusing more on your counseling, communication skills, things like that. Number 2 is the clinical management, like how you formulate a diagnosis. It's not about treating the disease, but treating the patient, managing the situation rather than managing the disease. So you have to formulate, a diagnosis and have a patient-centered approach, negotiate with the patient, make sure that you have, the patient with you throughout the consultation. Finally, a very important point that most of our, what you call, most of people from the Asian countries, they miss is that the interpersonal skills. We have an idea when it comes to PLAB 2 that we need to study theory a lot. We have to focus so much on our clinicals, examinations, history taking, the guidelines, but we tend to forget our interpersonal skills. Remember, that's the most important part, because number one, building rapport with the patient, giving the sense that you're with the patient, you're here to help them, gives you an upper hand when you go for the exam, because that shows that you're a very good doctor, you're a good listener, you're very empathetic, you have sympathy towards the patient, and the patient will then help you and open up. And the examiners want to see that skill, particularly in IMGs like us. They know that in PLAB 1 or the AKT exam, they have assessed our theory knowledge, and we are, obviously we have passed the PLAB 1, so that means our theory is really good, right? So right now in PLAB 2 or the CPSA, what they want to see is basically, are you a good doctor? Are you a well-prepared doctor? And do you have the scope in order to practice with the NHS, right? Are you reliable? Are you a good doctor? Are you a safe doctor? Do you have good qualities of a good doctor? So that's what they are looking for, basically. So remember, interpersonal skills are very important, and we at Amrak really focuses on interpersonal skill, right? Just a general idea about PLAB 2. Now, when it comes to what we have in offer for you guys, so basically we have a course of 50 hours, all right, where we have divided into 25 hours of interpersonal skills and clinical knowledge, and 25 hours of clinical examination skills, where you will be getting the simulation mannequins, hands-on experience with mannequins, and the sim man, which is one of the important stations in the exam. So we will be giving you with 2 free mock session as well. And if you want further mock session, you can talk to one of our consultants, and you can get that arranged as well. There'll be active role play sessions online, where me and Dr. Uveen, we can conduct one-on-one role play sessions during our classes as well, and the in-person hands-on experience with the mannequins. So regarding the mannequins, Dr. Hindu, can you just give a small introduction, how we went and spoke to University of Kelaniya, the Ragam medical faculty, to our students, so they can have a good understanding of it, if it's all right with you.
Yeah, we will talk about the mannequins when the presentation is finished at the end.
Okay.
The
Right.
Q&A session. Okay.
Right. Okay. So just have a note down of that. Okay.
Yeah.
So right. And what now there is another thing. Apart from the PLAB 2, what are the additional things that we provide in our institute? So number one, as we all know, as I told you earlier, it's not about just passing your PLAB, but there are certain things that you have to do before you can book the exam. For example, the EPIC verification, which is basically an online portfolio system where you verify that you're a doctor, you have graduated from this medical university, and so on. So we at our institute is going to guide you on setting up this EPIC verification and helping you in providing the necessary documents. Moreover, will also guide you on your visa process, because we know that PLAB 1 could be held in Sri Lanka or India or Pakistan, Bangladesh, wherever, but for PLAB 2 you have to go to UK, right? So we can also guide you with your visa, documents you need to provide, bank statements, what sort of letters, there are certain medical officers who needs foreign leave, foreign medical leave, so things like that. And finally, once you pass your exam, you're done with your PLAB journey, you come back to Sri Lanka and you have to start your GMC registration. So I did it personally by myself with a lot of research. So me and my team, we are going to help you on with how do you apply for GMC, what documents you need to do, good standing certificates, what have you been doing for the last 5 years, are you engaged in medical practice, are you engaged in a non-medical capacity, do you have any clinical gaps, etc. So just a brief introduction about journey to the UK for PLAB 2. This is what most of our students ask, because what is the cost, how much does it cost to go and come, and things like that. So if I take the cost breakdown, which was in 2022 June, as you can see here, roughly speaking, if you have the exam in June, all right, so normally we recommend students, if you're engaged in an academy in the UK, to go at least 1 month before. because you have to go there, settle down for a bit, engage in the academy, practice with people, and so on. So you have to at least have 1 to 1.5 months. Let's say minimum 1 month, right? So if you take 1 month, your accommodation is going to cost you roughly around £600. All right, and for your food, for your transport and miscellaneous, altogether it's going to cost you around £1,700, as you can see, and you have to pay for your academy. I think most of the academies in the UK right now is going to charge you 600 or more. I mean, everything is there online. You can go and have a look, because there are good academies in the UK, who does these programs as well. So it's quite expensive, and paying in Sri Lankan money, getting bank approval, it's quite hard. It's a bit of a hassle. So altogether, you might have roughly around 7 to 8 lakhs that will cost you. But the advantage of our institute, if you choose our institute, is that it is cost effective. Why? Because you don't have to enroll in an academy, because you're already enrolled in with us. You don't have to go 1 month before the exam. You could go just 3 to 4 days, or I don't know, maybe a week before your exam, and then you could sit for your exam and come back. All right. But if you engage in an academy in the UK, you have to go at least 1 to 1.5 months before, which is quite costly. Number two, sorry about that. Number two, we give you an in-depth and personalized guidance for your PLAB journey. What do you mean by personalized? Apart from PLAB 1 and PLAB 2, we'll be giving you, information regarding the visa process, the GMC guidelines, and your EPIC verification. Furthermore, you're saving time, all right, because most of my colleagues, I mean my senior colleagues, they were saying it's hard to get foreign leave. You have to sign so many letters. Getting 1.5 to 2 months from your, from the current work is very hard, and you might have to resign, things like that. But if you engage in the Amrak Institute, you can just go 1 week before the exam, just take a short leave, do the exam, come back to Sri Lanka, and save your time, save your money as well. Furthermore, it's easier to obtain visa to the UK. So, after the crisis, after the economic crisis and the breakdown, there are a lot of issues with the Sri Lankan government. So it's very hard to obtain visa. When you show that you have to go to the UK for, let's say, 1.5 months, you have to show at least 3 to 4 times the amount of the expenditure you're going to use it. For example, if it's 8 lakhs that you're going to spend in the UK, you will have to show 4 times, roughly 3 to 4 million, right? So if you engage in our institute, or if you are in Amrak, as I mentioned, just 1 week before the exam, so easy to obtain leave, shorter duration of visa, easy to obtain, so hassle-free basically. So that's another thing. And finally, as I said, job security, right? Because most of my senior colleagues had to resign from their government sector, join the private sector, because they have more time in studying but with a lesser pay, and it was a bit of a hassle. So overall, there is a benefit if you can choose the institute, our institute, Amrak Institute, where we provide the best possible to our candidates. And finally, thank you. This is a short presentation. And if you have any questions or further queries, you can ask, and Dr. Hindu and myself and Dr. Ubin is here to answer your queries. Thank you so much.
Yes, I'll give them a brief introduction about our PLAB 2 Academy, which we are going to have it in Sri Lanka. So in Sri Lanka, for the first time, we are providing our students with a simulation mannequin. And for that, we partnered with the University of California, and we are giving the students a chance to go there to the University of California to practice hands-on with the clinical mannequins. Dr. Shan, is it possible to show our students our skill lab, so they have an idea about the place? Is it possible?
Yeah, sure. Just give me a few minutes. Okay. Yeah, can you see? Well, I don't think it's clear, but yeah. Is it clear so far?
There's a video, yeah. Yeah, that is the skill lab that in University of California. So basically, this is what you will get in the academy in the UK. So we've actually brought the academy down here to Sri Lanka, so our students don't have to go 3 weeks prior and to enroll in another academy.
Yeah.
And this is the simulation mannequin. This mannequin has a pulse, it is breathing, it has all the different kinds of it can be simulated with different conditions. And so we partnered with the University of California to bring our students these facilities.
So as you can see, you can change the respiratory rate. You can, put in lung sounds. You can have a scenario with atrial fibrillation where the pulse is irregularly irregular, so on. Because that's one scenario you might get in the exam. So we are providing you with that as well, because it's a very costly process. But somehow we are lucky enough to, provide this to our students. Okay. Is that all? Okay, Dr. Hindu.
Yes. Yes. So before going, talking about the doctor shortage in the UK and the current situation in the UK, where I would like to ask Dr. Uveen to talk, I would like to ask the students here if they have any questions to ask from Dr. Shan.
Feel free to ask questions. It's okay. Don't be shy. I was just like you, a few years back. It's all right. You can type your question and send it to the chat box. We can read it and answer as well.
Okay, question
Yeah.
I normally get asked is for most of the students are who are the teachers who will be teaching PLAB 1?
Right. Okay.
So most of the students might have that question as well. So we'll I think is it possible for us to show
Yes, yes. Let me show you.
our teachers so they have an idea about it as well.
Okay.
And I think
So,
we got another question.
okay. So as you can see, right. So this is our basically our PLAB booklet where we are going to give our candidates, to our students, basically a booklet of what we are going to provide and what is expected from you. So these are our lectures, as you can see. We have Professor Dulani Gunasekara. She's a professor of pediatrics and who will be teaching you pediatrics. And then Dr. Pandula for medicine, Professor Dr. Shehan for medicine, and Dr. R.U.Waidyaratne, the one who is going to talk in a while for surgery. And for psych and ethics, we have Dr. Sara. And for GNOBS, we have Professor Ramya. Is it Harindu?
Yes, Professor Ramya is there.
Professor Ramya. So these are the lecturers that are going to be there, and this is a timetable, just an overview of how our content structure is going to be organized. And we are going to start with OET, and as I can see, there are questions. So I'll be sharing this booklet with our students as well. Okay. Yeah, Dr. Hines, there was another question, is it?
Yes, there's another question. Sasika Jainath is asking about the OET exam.
Okay, so could you please explain about it, Dr. Hindu, since you're gonna,
Yes, yes, Dr. Sasika, we are in our program. We have OET included as well. So OET course will be starting in February 16th, and it will be a 2-month, 6-week course. And after that, you'll be eligible to book the OET exam. And then if you pass, then you can book a PLAB 1 seat. And we are providing materials and everything that's necessary for our students. Everything will be given out. For example, listening, we will be giving the audio clips, and for writing, we will be giving case notes, and for for reading, we'll be giving papers. So likewise, everything will be provided. Yeah. Is there any other questions? And Nipuna is asking the cost of our course, and we will get in touch with Nipuna, one of our marketing. I think one of our marketing people will be getting in touch with Nipuna. Is Sonura here? Sonura, can you get in touch with Nipuna and provide him with all the details that's necessary about our course?
Sure, Dr. Arinda.
Okay. Okay, for those who have finished OET, do you have a course without OET materials? Yes, we do. So I'm guessing, Dr. Nipuna, I think you have finished your OET. Have you booked your PLAB seat?
Hello.
Yes,
I'm
Dr.
Nipuna. Yeah,
Yes.
actually we have booked OET in February, so we are preparing for that now. So
Okay.
that we will be needing some help with the PLAB, I think. OET now we are
Okay,
managing,
great.
right?
Yeah. So we do have a package for that as well, without OET included, with only our PLAB 1 and our PLAB 2 courses with the guidance. Everything that is there as well. You will one of our marketing people, so Mr. Sunra, will get in touch with you and provide you all the details necessary. Okay. Is there anything else? Is there any other questions? Okay, I think another question that might arise is, for example, now the people might be wondering, okay, now PLAB 1 is changing to UK Malay, and most of the students might not know how are we going to teach, how are do the professors have a syllabus, what's the content of the UK Malay, is it same to PLAB 1 or is it different to PLAB 1? So that's one question I think most of our students are wondering about. I think Dr. Shan, if he can show our students the content, the syllabus we got from GMC directly, so I think then they have an idea about the topics and the presentations that's tested in the UK Malay.
Okay, so basically we had emailed the General Medical Council and they had sent us something called the UK Malay Content Map, which will be implemented, I think, in 2024. I do have the content map with me right now, and that will be provided to you, students, and it's available online as well. And we'll be giving it to our consultant as well. So if I show it to you guys, let me have a. I'll share my screen. Okay. Okay. Can you see the structure, Hanido? So this is the UK Malay content map, which we received from the GMC, and as you can see, these are the things that they're gonna focus on, mainly the areas of clinical practice, professional knowledge, practical skills, A&Z presentations, things like that. For example, if you click on to A&Z conditions, you can see all the listed conditions here given here below. And what we have done is basically we have made a lecturer's handbook. Okay, this is our handbook, and we have made it where we have divided into each contents. For example, medicine, and if you move on to medicine, you can see there are certain topics listed from A, B, C, D, E, and then when we move on down, this will be provided to our lecturers and also to our students. And when you see the presentations, we have further divided into acute and emergency, cancer, cardiovascular, clinical hematology, and so on. So basically everything is structured and everything is already sorted out. If I take another example, we can take OBGYN, obstetric and gyn. Again, you have the topics, then you have the presentation, again divided into acute and emergency, cancer, cardiovascular, endocrine, general practice, infection, so on. So, we have to keep it brief and, short as possible. So this is just an overview. I'll hand it over to Dr. Hindu again. Yeah, Dr. Hindu, you can proceed with.
Yeah. So this is another question. Can I know the cost of PLAB 2? And the costs will be talked with you by our or by our marketing consultants. They will get in touch with you and they will give you the whole course breakdown from A to Z. Okay, we have another question. Do you have an OET course currently running? I'm taking the exam mid-March. Not currently running, but we are planning to start our OET classes on February 16th. Yes, so if that's something that you think that's convenient, you can join our OET course as well. As we'll be starting on February 16th. But since in mid-March, we'll be definitely finishing our OET course. So, Dr. Anne, I think you will be eligible to join our OET course. Okay. Is there any other questions?
Hello.
Yes.
Hello, sir. We are a group of 5 students. Like we are waiting for PLAB 2. It's in around some people are having in April and I'm having in May. And we have already paid for these academies. So I want to know whether we can get these mannequin and sim man courses like a 2-day course separately. If so, we can
Yes.
join that.
Okay. How many people are with you?
Around 6. Yeah, 6
Okay,
people
there
are
are
there.
6. Okay,
Yeah.
there are 6 people, and your PLAB 2 exam is in April, you said.
April, yeah. Some people have in April and some in May.
Okay, so you are asking if we can get the skill lab in around March?
Yeah, that's fine.
Yes, yes, that can be arranged as well. But we'll have to talk with the administration and University of California as well. And depending on their availability, we can get back to you. So, Dr. Rehana, I think, okay, Sonura, can you get Dr. Rehana's contact details so we can get in touch with them and we can confirm her request?
Sure. I'll get that
Okay.
done.
All right. Okay, Dr. Rehana, we will get back to you regarding that by tomorrow. Okay. Okay. Thank you. And is there any other questions? Okay. So now we'll be moving. We will. I will let Dr. Ween talk. So Dr. Ween, he's one of the general practitioners who's practicing in the UK. So I will let Dr. Ween introduce himself, and he will be talking about the doctor shortage and the and how vast UK is affected with this issue currently.
Oh, hello everyone. Yes, thank you for the warm introduction, Dr. Harindu and Dr. Shan. Yes, good afternoon. Yes, I mean, Dr. Harindu wanted me to talk about the doctor shortage in the UK. I think there's 2 problems affecting the doctor shortage in the UK at the moment, in the sense, firstly, there's an aging population in the UK, and therefore the number of patients to one doctor is increasing, and therefore there's a shortage of doctors, as well as the situation with Brexit is also affecting the number of doctors willing to come to the UK and work, because the continental European doctors are not willing to come to the UK anymore as much as what they used to do before Brexit. So that means that gives an opportunity for doctors from South Asia, from Sri Lanka, India, Pakistan to come and work here. So overall, it's a very welcoming environment here. I'm currently working as a general practitioner in York, in the north of England, and in terms of the work-life balance, there's a good work-life balance here. And in the future, things can only get better because in terms of the current political climate, I think in 2024, it's very likely that a Labour government will be coming to power, and that would mean even more doctors would be recruited from places like South Asia. So I remember Dr. Shan talking about the anxieties that a lot of our applicants have about getting a job here. I think there's plenty and more jobs available in the NHS in the UK for you to work with, in the sense there's always vacancies available. If you look at NHS jobs, there's positions available for trust doctors, and and the contracts are always there. So whether you want to work as a regularly contracted doctor, or if you want to do locum shifts, or shifts for a certain fixed amount of time, or the vacancies are there. And if you're qualified as a with a basic medical degree, then you can definitely get a job here. And I would encourage people to come here, because in terms of the postgraduate training, the training is well supported here, even as a trust doctor. So you can complete your career pathway, progress your postgraduate training in whichever specialty you like, and then get a job here, and yeah, even apply for a citizenship here. So it's a very welcoming environment. So I would encourage you all to come here, and looking forward to seeing you here as well, and looking forward to helping you out with the course with Amrak. I will open the floor to any questions that you may have. Feel free to ask any questions you have with regard to, say, the foundation program, or the training program here. So after doing my medical degree, I completed my foundation program in the UK, and then applied for GP specialty training. So so I've completed the GP specialty training program, and I have been working as a GP since 2021. So I can answer any questions you may have with regard to working in the UK. Yes, yeah. So Harindu and any of the
Yes.
guests, you can ask any question. And don't be shy. I was at your stage, so feel free to ask any questions. Really, yeah.
So, Dr. Ween, there is a question from Nipuna asking, can you explain what's meant by a trust doctor?
So a trust doctor, so say if you are not working, say if you're not under a training program, there are trust doctor jobs in whichever specialty you want to work in. So for example, I'll tell you my experience of it, in the sense, when I was a foundation year 1 doctor, there were trust doctors from all parts of the world who worked in my ENT department, and they are pretty much trust senior house officer doctors who can have a contract, say, for 1 year or 2 years in that trust. It means that as a trust doctor, they wouldn't be locum doctor. They wouldn't be directly under the training program, but they will be working, say, for a trust. So in my case, it was the Leicestershire Trust, and it just means a different term, and that you're not in the training program if you're a trust locum doctor. But at the end of the day, all doctors under the training programs, as well as locum SHOs, are employed choice of the trust. So essentially, it's the different route you're taking. So if you're coming here and wanting to be in a specific training program, you're a trainee doctor in that trust, whereas you can also have a locum senior house officer job under the trust as well as a contractual period, but you won't be necessarily attending the weekly training education programs. Hope that answers the question.
Thank you, Dr. Win. We have another question from Anne Perera. I think you addressed it earlier, but just so she was asking if you could briefly talk about the work-life balance in the UK as a new doctor, as opposed to Sri Lanka. So that's a
Yes,
question.
so yeah, I think in terms of work-life balance, I think that was one of the main reasons I applied to become a general practitioner. So currently, so you can pretty much work as much or as less as you want. So it really depends on how much you want to work. So I'm currently doing 4 sessions a week, which means that I get Mondays and Tuesdays off to myself, and then I work Wednesday full day. So that's 2 sessions. First, a morning session at the GP surgery and the afternoon session at a prison. So I'm practicing doing some prison medicine as well. And then on a Thursday and a Friday morning, I'm again at the GP surgery. So essentially, I get Mondays off, Tuesdays off, Thursday afternoon off, and Friday afternoon off, and the whole weekend as well. So it depends on how much you want to work. So there are general practitioners who work 8 sessions a week. So that would mean 4 working days a week. But whereas for me, I think I prioritize my like off time more. So I work the 4 sessions, but it doesn't mean that I can't work on the other days. If I want to, I can still take up locum shifts, locum jobs. If I'm having any financial difficulties, I can do extra shifts at those off times. It just all it means is that under my contract, I only have to work 4 sessions a week as a general practitioner. So in that sense, the lifestyle balance, especially as a general practitioner, is very good, I would say, and healthy. Yeah. Um, that's more as a general practitioner, but were you asking in terms of the lifestyle balance as a junior doctor as well?
I think yes, Anne might be referring to that as well.
Sure. So as a junior doctor, I think it's a bit, it's a bit more difficult in the sense that, so when I was a junior doctor, I worked 5 days a week, Monday to Friday, and then depending on the rota I am on, so if I'm doing the medical rota or the surgical rota, I'll be doing night shifts and weekends. But ultimately, there's a guideline in terms of the European Working Directive in the sense of how much you can work per week. So the rota team will always make sure that you will have the necessary gaps and the off days for you. Now, if you wanted to say take part-time training or what they call less than full-time working training, then there's a pathway for that as well. So some especially mothers with young kids go for that less than full-time training where they don't work like full-time. They have that option of maybe working 2 days a week. So in terms of flexibility, the NHS is very supportive for you for flexibility. But I mean, as a junior doctor, if you are doing full-time training, yes, it will be like you'll be doing your shifts. But but once you go through that training pathway and you become more qualified, I think you have more flexibility with the working hours you do. Hope that answers the question.
Yeah, thank you so much, Dr. Win.
Yeah.
There is Dr. Hindu here?
Yes, I'm here.
Dr. Hindu, there is another question from Sasika, I think, right? Sasika Jainath.
Uh, okay, wait. Yes. So Dr. Sasaki is asking, what is the difference between hospital job and GP job? Is
Oh, yeah.
there any qualifications needed to practice as a GP?
Yes, so I guess that's the difference in terms of the system in Sri Lanka and the UK, because in the UK it's very much primary care orientated, in the sense that GPs or the general practitioners are the gateway to the NHS and to secondary care. So unless it's an emergency, you wouldn't necessarily go straight to hospital. You would come to your general practitioner, and the general rule of thumb is that 90% of the UK medical graduates become general practitioners once they qualify. So you need to have gone through 2 years of foundation training, and then another additional 3 years of general practice training. So overall 5 years after your basic medical degree to become a general practitioner. So there it's pretty much like, say, there's core medical training, core surgical training, and then general practice training. So there's a specific pathway for general practice training, and after your 2 foundation years you need to have done 3 more years of general practice training to become a fully qualified general practitioner. So in my say, so I did the 2 foundation years, and then when I applied for the general practice training in my first year, I did care of the elderly medicine, then accident and emergency, and then general medicine, as well as psychiatry. So those were my like the 2 years as part of general practice, and then for my final year as part of the general practice training program, I was based in GP surgeries and different. You're allocated like a more city center GP surgery, and then a more rural GP surgery, so that you get the breadth of experience working in a rural as well as urban settings as a general practitioner. So yes, there's definitely a specific general practice special training program, and that's 3 years after your foundation years, and you need to have done that to qualify to work as a general practitioner. As a hospital doctor, you would be completing your core medical training, so that's pretty much 2 foundation years, another 2 years of core medical training, and then your registrar training. So whichever specialty in medicine a subspecialty you want to go in medicine. With regard to surgery, it will be again 2 foundation years, and I think 3 years of core surgical training, and the registrar years until you become a consultant surgeon. So I mean, those are the different pathways you have. And in psychiatry, again, it's 2 foundation years, 3 years of core psychiatry training, and then the registrar training, and then a consultant. So yeah, so I would say in terms of general practice, the general practitioners are based in the community, and there's a lot of, say, power and financial control as a general practitioner, because if you're referring someone to hospital, it has to go through the general practitioner, and we have to make that referral to the hospital for the patient to get that hospital appointment in secondary care. So I would say that's like a brief overview of the difference between general practitioners and hospital doctors. Thank you. I can see more questions popping up on the chat.
Yes.
Yes.
Yes. There's one question after PLAB 2, are we starting our jobs at FY1 level? Well, Nipuna, it depends on if you have done an internship or not. If you have done an internship, an acceptable pattern of internship, without what you call a gap, or it is not uninterrupted, well, you can, provide it to your GMC, get a full GMC registration, and then apply for your FY2 or SHO training level or the program. If you haven't done your internship, well, then yes, you have to start with your foundation year 1, and you have to join through the UKFPO foundation program, which you have to apply through this ORIEL website. And there are, there is a deadline, and you have to apply before your deadline, and then they'll process, and it takes around 6 to 7 months. It starts in August, I suppose. Is it, Dr. Win?
Yes, I remember applying through the ORIEL website, and the good thing about the ORIEL website is you can pretty much put your preferences. So when I was applying for, say, for foundation years, I wanted to get a bit of medicine, surgery, accident and emergencies, and psychiatry. So I chose those rotations, whereas you can pretty much put your preferences and which part of the UK you want to work in. And obviously, say, places like London are more competitive, but the more you go outside of London, you might get your first choice. Yeah, it's all a ranking system, in the sense you can put what specialties you would like to do your foundation year training program placements, and then you can also put your preferences in terms of where you want to work in the UK, and then they will let you know as to where you ranked in terms of your placements and where you want to work in. So you have a lot of control where you want to work, which specialties you want to do your foundation program training in, and where you want to work in the UK as well. Yeah.
Well, thank you, Dr. Win. And I think there is one more question from Sayuri. Is the diploma in family medicine by Postgraduate Institute of Sri Lanka accepted in the UK after passing PLAB?
The honest answer is I don't know, but I'm assuming it will come in very handy, in the sense that so what I have is the membership of Royal College of General Practitioners. So I'm assuming that's the equivalent of that in Sri Lanka, or so you can always ask the GMC, but I'm assuming if you want the MRCGP, you'll still have to go through the general practice training program. But to be quite honest, I don't know the exact answer to that question, I'm afraid, but I'm assuming it will come in very handy if you are doing the general practice training program. Yeah, any other questions, or anything else that you want me to explain with regard to that question?
Yes, there's another question, Dr. Win.
Yeah.
Dr. Win is asking, with the current tax issues and inflation, what kind of a salary does a junior doctor, FI1, FI2, get in the UK?
So I think basic take-home salary would be for a junior doctor at, say, FI1, FI2 level. But I think when you're starting off as FI1, it may be around £1,500 per month. That's after all the taxes deducted. The take-home will be around £1,500 per month. When you're FY2, I think it can go up to around £2,000 per month after all the taxes are taken away. So take home will be around £2,000 when you're FY2 senior house officer.
Okay, so thank you, Dr. Ween. We have answered almost all our questions. And
Did we miss this question? How about joining ST1 GP training after MSRA? Okay. Most people say it's difficult.
No, I wouldn't say it's difficult, in the sense that what you have to do is pass the applied knowledge test, and then well, sorry. I think with regard to yeah, I think Dr. Shan has gone through the AKT, so I think they are trying to amalgamate it all into one exam, which is the AKT, and the entrance exam to GP is quite easily passable, and there is like a written test, and then there's the lidoscopy, but yeah, pretty much 9 out of 10 people who apply for that will get a GP training course. So I think yeah, it's an easy exam process to get into general practice, because the UK wants general practitioners, and they're short of GPs, so they're always trying to recruit as many people, junior doctors, into the general practitioner training program. So they try to make it as easy for you, but obviously you need to have passed the written exam and the OSCE. But considering you all are qualified medical graduates, I don't think it should be a problem. So they will offer you the job. Yeah. And I think what maybe Dr. Shan will also explain, like what you look into in the UK is very much your communication skills. So you're exploring the ideas, concerns, the expectations of the patient, and identifying the verbal, non-verbal cues, and almost being at that having that understanding that the doctor and the patient are at the same level, and come into a mutually agreed shared care plan. So yeah, overall, as long as you display that you're a empathetic doctor, and that you come for that you agree on a mutually agreed plan with the patient, you should be able to pass through the exams, especially the OSCE side. And the written exam, I think any medical anyone who is a doctor who has the basic medical degree at FY1 should be able to pass it. Yeah.
Dr. Harindu, there was a question from one of the candidates earlier to me, asking why, why we are conducting the OET classes earlier, and what's the whole purpose behind it. So I'll just briefly explain why. It's because now most of our students are waiting until the PLAB 1 seats open, right? So then what's going to happen is that there are candidates all over this world who have already completed their OET or IELTS. So when the PLAB seats are released, let's say you haven't done your OET, you won't be able to book your PLAB 1 seat. So then you're going to miss it. And then you have to wait for another year, or maybe 1.5 years. I don't know the waiting period, but at least a minimum of 1 year. So that's why we all recommend you to, quickly do your OET or your IELTS, finish it off, so that you have, 2 years. The validity period is around 2 years, and you can quickly book your PLAB 1 when it's available. So that's the answer for that question. Yeah. Is there anything else, or yep, doctor, there is another question. During the GP training period, do we get a salary? Well, I think yeah, it's
Yes. Yeah, in fact, you're very well paid as a GP trainee, as a registrar, because you're pretty much paid at the level for a GP working 6 sessions, because as a GP trainee, you're expected to be at work for at least 4 or 5 days of the week, and you will be working roughly 8 sessions a week. So one session is half a day, and as a GP trainee, GP registrar, you'll be working 8 sessions a week. So you will be very well paid as a GP trainee, as a GP registrar. So as a GP trainee, your pay would be approximately £3,200, £3,000 per month as a GP trainee.
okay. Okay, thank you. Another question, does the Amrak course assist the participant applying for jobs? Well, Nipuna, I mean, since we are starting up our program, we are mainly focusing on the academic side of it, And that's why we are guiding all our students and candidates in preparing for PLAB 1, I mean from OET, PLAB 1, PLAB 2, getting their EPIC, visa and GMC. In case of job application, I don't know if we are into that yet, because for certain doctors and for certain students, it depends on each individuals. You might have a practice of 3 years, another doctor might have a practice of 2 years. You might have to show more documents since you were not engaged in a medical capacity. Then there are various things you need to consider when you apply for jobs. And there are doctors who have done most research work, teaching, presentations, and their portfolio is a bit well built, rather than another doctor who has just completed PLAB 1 or PLAB 2 and they're fresh out of the medical college. So they might have only a little bit of experience in the field. So it depends on individual to individual, and I don't think we right now as institute can handle the job issue as well. However, in the future, yes, we are considering that as well. Okay, I hope that answers Nipuna's question. There's another question. How long should we wait after sitting for PLAB 1 to apply for PLAB 2? Well, it's a good question, Sasika. Well, PLAB 1 seats are limited. However, PLAB 2 seats, they release daily around 72, because we have two exam centers in GMC. One is in Hardman Square, one is in Hardman Street. Hardman Street consists of 36 students, and Square and Street. So normally it's divided into two, 36 students each. So you have 72 candidates. And so daily there are 72 seats released. PLAB 2 seats are abundant. However, PLAB 1 seats are very limited. So that's why we advise all our students to quickly do your PLAB 1, finish it off. So you can slowly book and appear for your PLAB 2. Roughly speaking, 5 to 6 months is more than enough for PLAB 2. Even without working at UK. Well, yes. After PLAB 2, you can get your GMC registration. Dr. Uwin, I don't think there's an issue with GMC registration, is it? Like, you don't have to necessarily work in the NHS to get your GMC registration. Is that right?
So, yeah, I'll explain that. Bear with me. Yes. So, with regard to the GMC registration.
Dr. Win, you're on mute.
Dr. Win, you're on mute. Yeah, Dr. Win, can you hear me?
Yeah, I can hear you.
Yes.
I'm just.
We can hear you now.
Can you hear me now?
Yes, we can hear you clearly.
Okay, so I was going to say with. Hello, are you still able to hear me, Shan?
Yes.
Yeah. So yeah, with regard to GMC registration, so once I completed my medical school training, I applied for the provisional registration with the GMC. So that I got even before working as a foundation year 1 doctor. And then with the provisional registration, I completed the foundation year 1. And at the end of the foundation year 1, you can apply for the full GMC registration. Now that I think that differs slightly with how maybe Dr. Shan went through, but it was a bit different in my case because I did my medical school training in the UK. So I applied for the provisional GMC registration immediately after completing medical school, worked as a foundation year 1 with the provisional GMC registration, and at the end of the foundation year 1, you can apply for your full registration with the General Medical Council. So I think even before you start working at the NHS, you can apply for your GMC registration.
Yes, that's right. And regarding the full GMC registration, as Dr. Win said, foundation year 1, if you have done an internship in your home country or any, for example, I did it in Bangladesh. So if you have done it and it is an accepted and a valid pattern of internship, then you are eligible to apply for full registration with a license to practice. And regarding the next question, GMC registration, is it lifetime? Well, no, you have to renew it yearly. That's what I've been told, and I think, is that right, Dr. Win? You have to renew every yearly?
Yes, yeah, so there's appraisal. So as a general practitioner, I have my annual appraisal, and where you have a designated almost like a supervisor or of the deanery, and they go through that yearly appraisal with you, and you need to have completed your portfolio and keep your, say, personal development plans up to date. And that's a yearly basis. But I think in terms of the revalidation, it's more of a 5-yearly thing. So you will have a short appraisal, like a mini appraisal on a yearly basis, and then at the end of the 5 years there will be an accumulation of, say, those 5 appraisals into one, and there will be a revalidation. So, and you need to pay your general medical council fees on a yearly basis as well. Yeah, to keep your registration up to date. Yes.
And another question that was asked initially was that the amount, how much does it cost? So generally, if you're a fresh medical graduate and you graduated within the last 5 years, the cost is going to be less, I think around £160. But if you have your primary medical qualification, and after 5 years, then it's going to be a bit on the higher side, around 400 plus pounds. So I mean, it's going to be on the higher side. So everything is there on the GMC website, and you can go and access and have a look at it as well. So I think Dr. Win, is there anything you want to add before we can end the session? I think we have answered all the queries.
Yeah, I think, say, if you're coming to the UK at a foundation year 1 level, then as part of your, say, UK foundation program training, you will be required to, say, fulfill certain competencies, like in basic procedures like venipuncture, cannulation, catheterization, and that all adds up to you eventually completing your foundation year program and completing your foundation year 2. But once you've done all that, and say I got my full GMC registration at the end of FY1, as long as you've completed those basic competencies and you can show that evidence, then you can definitely go through the process of applying for the full GMC registration. So it's not hard. It's something that you can get if you show the evidence. Yeah.
So I think we have answered all the questions, and I think we can wrap up the session. And Dr. Hindu, are you here? Or?
Yes, so we will end the session. Before that, I want to share the number of our marketing consultants, so you can call them or message them asking for any of the other information that you might want to know. So I'm gonna just type the number on the chat. Maybe you can WhatsApp them. Sonora, are you there?
Yeah. Yeah.
Could you share the numbers of the our marketing consultants so they can get in touch
Sure.
with them?
Sure,
on
sure.
on the chat? Okay. So whoever has any questions can get through these numbers and ask them any questions if they all have. Okay, then we will end the session now. And thanks to everybody who joined. And thank you, Dr. Shan and Dr. Uwe. And okay, we have one question. If we completed the internship in Sri Lanka and which is accepted in UK, can we straight away go for FY2 level, doctor? Dr. Shan, are you there? We got a question last minute.
Dr.
Dr.
Shan, you're on
Shan,
mute.
Oh,
you
sorry.
are muted.
Can you hear me now? Yeah.
Yes.
Okay.
Yeah.
So, since you have done, an internship in Sri Lanka, you are eligible to apply for your full GMC registration once you pass your PLAB 2. And when you apply for full GMC registration, you will be eligible to apply for a FY2 or a senior house officer, SHO level, or a junior clinical fellow position. So all three positions are going to open up to you as well.
Yeah, and I've seen SHOs join at FI2 level from South Asia after they have completed their internship in India, Pakistan, Sri Lanka. So yes, you can apply straight to FI2 level. I can confirm. Yes.
Yes.
Okay.
Is that
Thank you, Dr. Shan, and thank you, Dr. V.
Pleasure.
We will
Yeah.
end the session now,
Thank you.
and thank you everybody for joining.